Discover KDH Collective's Leaning into Therapy podcast, an enlightening exploration of therapeutic approaches and evidence-based protocols. Join us as we delve into the vast landscape of therapeutic interventions, guided by the belief that collective intelligence surpasses individual expertise. Led by Katie Holmes, a licensed professional counselor with 16 years in private practice. This series offers valuable insights, expertise, and training from a team of skilled therapists. Prepare to immerse yourself in the world of therapy, created exclusively for therapists by therapists. So today I have Monet here, and I am going to interview her. Monet, could you tell us just a little bit about yourself? I'm Katie. I am the interviewer today.
Yes. So I'm Monet David, licensed professional counselor, and I have been practicing for, math is hard. I don't know, 8 years now. And I specialize in working with adults. I love working with the LGBTQIA community, and I am pursuing my ADHD CCSP certification, which will allow me to work with late diagnosed neurodivergent adults. So all kinds of things.
I love that. I love that. And I know in the future you're doing a class on sexuality and neurodivergence, which I'm really excited about. But today we're going to talk about childhood sexual behaviors.
I know, very taboo, very uncomfortable topic, but necessary topic.
Yes, yes, yes. I agree. Why is it necessary?
Well, and one of the credentials I forgot to mention was my 170 plus hours in sex education. So that kind of helps me be somewhat of an expert on the topic. But I mean, I think the answer goes hand in hand with that bit of information. As therapists, there's so much breadth and depth to what we need to know as practitioners that grad school cannot possibly teach us. And something that I love to point out to people, because I earned every minute of it just as much as you did. Traditional master's programs are only 2-year programs, which is still a chunk of time. But for master level clinicians, we do 3 years, and we still leave like fledgling little babies out of the nest. And one of the things as a little baby therapist, I realized was I don't know anything about sex and sexuality outside of like what I've done just as like a layperson doing personal development stuff. So professionally, I really wanted to learn about it. And then I got really jazzed because I was like, well, if I don't know, I bet a lot of other people don't know either. So let me teach them. And I initially, upon graduation, started working with children, and I was coming across this universal sort of scenario that I love to speak about in relation to this class, where it was like a concerned parent, caregiver, foster parent, adoptive parent would come to me and say, I caught my child, or I caught this kid doing this sexual behavior. Were they molested? And as judge, jury, and executioner in that situation, my eyes were like, I don't know, because I had no training on it. And so I pursued the 170 hours. And then I was like, I really want to empower other therapists to know about these things, particularly with the popularity of play therapy in the last, 2 decades. It's important for clinicians to know, I call them normal versus abnormal behaviors, and embracing the discomfort of talking about this. Because when you do put children and sexuality in the same phrase, it probably hits a lot of red flags and alarms, as it should, right? Because oftentimes the context with which we talk about children and sexuality is very negatively skewed. I think about sensational headlines or documentaries, or I don't know, it's so taboo that like its taboo-ness gets in the way of learning about what is acceptable behavior and growth and development in children. So I want to set the record straight.
Well, I love that, because I think even if you work with adults, with kids, people will talk about things that they think is trauma, right? And from their childhood, when you're like, oh no, that's normal sexual kind of play between two children at the same age. That's actually not trauma, but their adult perspective of it is that. It's really an interesting topic. I think even the way people look at themselves is affected, So their own view of themselves as adults is affected by this lack of
We were talking, yeah, like I see that conversation happening more often than not on social media now. Like people are really kind of facing it and saying, like, is this, was this abuse? Was this not abuse? Was this normal growth and development? And considerations around that. So I think it's becoming less and less taboo. But we have this weird fixation that children are these pure, innocent beings to the exclusion of their own human sexuality. And I think that's where we get a lot of things wrong. So um, I love to kind of dive into how we've gotten to that point as far as like historical um,
I love that.
considerations. Yeah, of just like how have we treated children? Like childhood is a relatively new concept, right? Because back in the day, children were just seen as like mini adults. And so like we put them to work in factories, right? And then we had this pushback of like, well, no, we children deserve to have a childhood, and childhood should look like this, without really consideration around, again, human sexuality. Like when you are born, you are a sexual creature. You are born of a sexual experience and you come out, and like that's part of you. It's very natural. Um, which I think just saying that really freaks a lot of people out. Like, what do you mean, children? And I like there's this distinction that I feel like I make in the class about like, yes, children are inherently sexual, right? That does not mean that we expose them to sexual content because they are sexual. It means that we don't freak out when they kind of naturally, like you said, explore sexually. We teach about boundaries and we teach about bodily autonomy and consent, but we're not saying here's this video, go watch it kind of thing.
It's fascinating how people go from one
0
extreme
to
to the
60.
other with it.
Yeah.
Yeah. Yeah. When there's all these points in the middle that are probably like teaching consent, very, very, very important, if not the most
Mhm.
important thing. And if we can't even talk about it because we're ashamed that our kid's doing it, then how are we going to teach consent? And as therapists, if we're uncomfortable with this subject, where are we guiding our clients to?
Yeah, that's a good point as well.
Well,
Good.
in the historical context, you said childhood is a new thing.
Newer
Like
concept, yes.
when you like what new how? Like what year did this start being, you know?
I feel like I'm a sociologist first and foremost, as much as one can be with a bachelor's level sociology degree. Historically, I'm thinking like at we went from an agrarian society where you had children to have hands to do the work of the home. And then we progressed into like the industrial revolution where we put kids into working in factories. And then I think after that, there was this real like, oh, wait, let's let children be children. So it's got to be sometime after the industrial revolution. I don't have the exact date, but this kind of thing of like, well, the wealth is going, like workers are working, they're moving out of the rural into like urban areas, and the nuclear family starting to form, so the multi-generational stuff is going away. You just have like mom, dad, son, daughter, dog kind of situation. And yeah, then it was like this focus of like children need to be spoiled and they need to like have all the toys and they need to go to Disney World once a year, like that whole thing. And from that, I think a little bit of their humanity kind of got wiped away because it's like, well, they need to be this pure vessel of light and love and all. And it's like, have you met a kid before? Sometimes they're that, but sometimes they're awful, right? Because the frontal cortex is not done cooking. So they're impulsive and they're annoying and they're irritable and they don't act like the way you want them to act because they're unpredictable, and like it's all those things for them. Um
Well, it's interesting what it says about our culture that
mhm.
we think that sexuality is bad or the only way something can be pure is if it's not sexual.
Exactly.
I mean, that's a whole probably podcast in and of itself. But
Yeah.
in this, I think context, you're trying to really help clinicians identify what's normal,
Yeah.
whatever.
Yeah. And then convey that information to the families that they work with of like, hey, 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 this is fine. This is okay. this is just going to be some redirecting, and it'll probably be corrected very quickly. Sometimes some behaviors are like, ooh, okay, we're getting into like, so whereas that example is like a green, we're getting into yellow and red territory, right? And I make that discernment in the class of like, these are things that are like to be expected, very normal. Yellow is like, ooh, okay, there's something going on there. And it may not even be that the child was harmed in any way. Perhaps they were just simply exposed to something and they're processing it. That happens, right? Like I think of the gold star example of Cinemax transitioning to Skinemax. So that is as simple as a parent watching a movie on Cinemax, falling asleep on the couch, and it's midnight, TV still on, and Skinemax is on. Maybe child got up to go to the bathroom. They witnessed some sort of soft core situation. And now they're like processing in their brain. Like, I watched something that I didn't really understand. I'm going to reenact it to kind of make it make sense because that's what kids do. And that's easy. We just teach parent like, okay, maybe put a timer on the TV if you know you're prone to falling asleep at night when you're watching your movie so that it gets shut off before the Skinemax turns on. Like, so easy and simple. And then you see how I'm talking about it very matter of factly. That is just as important of like tone, non-judgmental, like we're going to solve this together as a team, me as clinician, you as parents with the child, that kind of thing. Like it can be that practical.
Well, and I love all this because I think often parents won't want to tell us because they think we're going to call CPS. They
Yeah.
think their kid has been abused, that's the only way this child can be enacting this sort of behavior. Um, I don't know why abuse always has to be the first thing, but then parents start really questioning their own competency. It becomes a whole thing. When
Mhm.
really, as clinicians, we're empowering them to know this is normal. And if we didn't have the fear and shame around it, if there was more education,
Yes.
people would be more likely to talk about it.
Agreed. Agreed.
Man.
We get in our way so badly sometimes with things like this because it can be that much of a simple fix, right? And yeah, I think being able to be candid with clients and parents and children about like, I am non-judgmental, like let's just face the problem together sort of thing can be so therapeutically valuable. So I try to kind of instill that sort of attitude with people who come to the class of like, it's okay. And it can be okay. Like mistakes happen, fix them.
Yeah, I love this. I love
Mhm.
this. Because it's relational, right? And you
It
are
is.
relational. Yeah.
Yes. And like I don't do data and statistics well because I'm just like my brain can't compute. But I will say one big piece of research that I always kind of hold close to me. There was research done. Children exposed to their parents having sex accidentally is actually kind of a positive thing. They came to realize that like um I'm not there's a clear distinction between intentionally having sex in front of your child and then your child walking in because they had a nightmare. Um
Which I think is common.
like the Sex and the
Seriously.
City episode where Brady sees Charlotte and Harry having sex. It's okay. It's actually positive because once the child sort of comes into their own, starts maturing, they'll put the pieces together and be like, "Oh, my parents have sex, and like my parents love each other under the best circumstances." And that's okay, and that's a good thing, and it's a normal and natural thing. Like it's not a big deal. Um, Again, very different from intentionally having sex in front of your children. Don't do that. We're not saying that. But if they walk in on you, it is okay. You haven't harmed them. If anything, you may be giving them a snapshot of healthy sexual expression. So
I love that there's research on it because it is a common, there's so many movies about it, right? Like
yes.
it's such a common thing. It happens for everybody.
Yeah.
Or a lot of us, right?
Yeah.
Yeah. And we
Yeah.
are a little disturbed when we're older, but again, I like that the research says it's good for us because I'll be honest, my parents were affectionate and I did
Mhm.
accidentally walk in when I was young. And that was whatever it was, right? But they
Yeah.
were always very affectionate with each other, which is really
Mhm.
interesting. Yeah, cool. So what about the multicultural piece? How does
This is
multiculturalism affect it or play in?
Yes, I am most proud of that aspect of like putting the class together and talking about clinicians with it because like we don't exist in a vacuum, right? So we're looking at the intersection of childhood and race and ethnicity and society and cultural norms. And not every child exists in the same way. So one thing that I really take time to emphasize and highlight is the concept of adultification, particularly in children of color, particularly in Black children, where we can literally have a white child enacting the same behaviors as a Black child, some sexual behaviors, and the grace that is extended to the white child is non-existent for the Black child. The statistics, again, I can't put numbers to it, but basically, folks in power and in positions of authority over children tend to view Black children as older than they actually are, or more mature than they actually are. And so they are not given the same considerations. It's often very punitive in nature if they begin to act out sexually, rather than providing supports to them that would allow them to like do boundary setting, bodily autonomy, all that stuff again. And so I definitely want clinicians who participate in my class to not be a part of that system, to really break it and to like kind of confront it head on. And we even talk about the uncomfortable nature of having to confront parents about their own ideas about sexuality, because sometimes it starts at home. There's this internalized racism that can take place, or a parent who's engaging in a parenting style that's very authoritarian, which we know serves a purpose in some cultures. It's necessary, right? Like, let me be tough on my child so that law enforcement doesn't have to intervene and be tough on my child. And so sexuality doesn't escape that that conceptualization either. So it's this multi-pronged of like, okay, the sexual behavior is happening with your child. Let's assess your attitude, mom or dad or caregiver. Let's talk about how you're arriving to this understanding of your child's sexuality, your own experiences in childhood with sexuality, and how can we kind of like break this sort of generational curse of things sometimes, because you can almost go back and back and be like, well, my mother and my grandmother told me this is how young girls are supposed to be or how young boys are supposed to be. And there ends up being a lot of pathology just within the family system that doesn't have to be there. So that is just kind of like a snapshot of the multicultural sort of considerations we talk about in the class.
I love that because it's really looking at, it's almost like the layers of it, the history,
Mhm.
then how it relates to what we're doing, what other professionals are doing, and how it relates to the clients in their own family,
Mhm.
and how it might be played out there. Man, there's a lot of levels to this. Sexuality might be, I don't want to say one of the most taboo things, but I kind of feel like it is. The more we talk about it, I'm like,
I think where we live in the Bible Belt in the Deep South, we still have a lot of work to do. I think perhaps in other more progressive places, this may not be or feel as taboo, but maybe that's just me being naive about it, looking to greener pastures when they're not that green. But yeah, in this area, we tend in Louisiana, for those listening, we tend to rank pretty low in a lot of areas that would allow us to not feel so taboo. So I'm thinking like STI rates. Well, we rank high in those, but education, we rank really low. So like people aren't empowered to make informed decisions because they're not being given the information they need. And that goes with, sex and sexuality. It's not a mandated class, a mandated curriculum in the state of Louisiana. And then it's also, when they do offer it, it does not have to be medically accurate, which is very concerning. And sometimes they only teach abstinence, which has its place in sex education, but doesn't really kind of provide students with the whole consent spectrum, and holistic sex education. So sometimes we just set up kids for um, failure in that way. So,
sexuality, man. I think you're right about the Bible Belt and this
mm-hmm.
area. And so sexuality is probably more shamed or frowned upon, but childhood sexuality, I would say that's probably across the board. I would say that it would probably be different outside of our actual American culture, but in the American culture, it is definitely super taboo. Um, yeah. So I'm really excited that you're doing this course and that you're into this stuff, right? That you learned a lot about this so you understand in a special way. I mean, it's more than just like I read a book, right? You went
Mm-hmm.
studied like sexual development. What was the course? Was it across the whole lifespan?
Oh yeah, like so for the program that I was in, gosh, we did a childhood, then we did like an adult, then we did a geriatric class, and then since then I've taken some additional classes that do center around like adolescent sexuality and things to be considerate of. I don't remember the name of the class specifically, but I do remember we did the whole lifespan, and each section of the lifespan received a lot of attention. So that made my little sociology heart very proud.
Happy. I love
Mhm.
this. I love
Yeah.
this. I'm excited about the course, and I like that you continue to learn about this topic. Are there, I know we didn't talk about this, but I'm just curious, are there any neurodivergent considerations? Any sort of
Oh my gosh, absolutely. So, I think about stemming behaviors. And one of the things that I really like to impart to participants in the class is kids operate from a place of if it feels good, I'm going to do it. And it can really be period, end of statement, like it's not anything more. So what we often see in small children who may be neurodivergent is some kind of sort of touching of the genitals, right? And it's immediately, oh my god, did somebody teach them how to do that? Oh my god, did somebody touch them there? Like that whole thing. No, oftentimes we can eliminate that pretty quickly. It is purely I am self-soothing, and how I self-soothe is by touching my genitals. So like I talk about just considerations around neurodivergence, hyperfixation, bodily autonomy. We talk about the likelihood of victimization, unfortunately, for disabled children. Like they are greater at greater risk and more vulnerability to being abused, right? So we want to be vigilant. We want to make sure we're teaching them language if they are speaking, of how to say no and how to report if something has happened. But yeah, I think it really manifests in those sort of physical stemming behaviors more often than not. So like helping people not freak out, basically. Um, if little Johnny likes to touch his penis before he takes a nap, it's fine. It just feels good. And so we redirect. We say, "Oh, can you hold a soft blanket when you go to bed? Can you rub the soft blanket?" Like that kind of thing. So again, very easy fix, very easy redirection. It's mostly the adults who are freaking out about it, right? And rightfully so. They just want to make sure the kid's okay.
well, it comes from a good place. And I
Yeah,
do
absolutely.
find it interesting that we always go to they must have been abused. I don't know what that
Yeah.
is, but
It's
that
just a
is our knee jerk.
fear. Well, because okay, we talk about vulnerability. Kids are exceptionally vulnerable, right? Like physically, they're still developing. Like I'm thinking of the baby like having a soft spot in their head. That's terrifying. How do we get it so wrong biologically that they show up with like a soft spot, right? And I think that that vulnerability, I don't know that I'm not a parent, but I think that vulnerability just stays at the forefront of your brain for your child's entire life. So whether
Mhm.
they are physically vulnerable, sexually vulnerable, emotionally vulnerable, um, there's always a facet of them that it's like they're not ready for the world yet. They're not ready, and yet we have to put them out there. And so
Yeah.
it's like push and pull of God, I don't want anything bad to happen. And quite frankly, like the 24-hour news cycle, I think is partly to blame for all of this. Like sensational stories get the headlines, they get the views, they get the clicks. And oftentimes those are really images and stories of horrible abuse to children. And they're probably more rare than we realize, but because we have such a large system which with the news exists, you can get about 10 of those stories a day, right? And so it feels like it's happening way more frequently than it may actually be happening. Um,
I tell my mom this all the time. We kind of go, 'cause I'm like, Mom, it's just what we're being fed. It's not necessarily
yes,
that statistically it's happening more. Um,
exactly.
yeah, but it's hard to differentiate that. That
For sure.
visual, there's probably something with our brain when we see a visual of it that even though rationally we know the facts, the visual is way more powerful than the prefrontal, you know. Yeah, so it makes sense. Well, any last little bits of information? This was super informative.
Hmm. I mean, I think there's good research out there. I think talking to your kids about sex, like you being the educator, you being the first person to introduce those ideas to them is really important. And so I always recommend families go to amaze.com. It's a great curriculum, and it goes from like infants and toddlers all the way to like teenagers. So it gives you the script of how to talk to them. And so I like to just empower parents when I can.
I love that. Well, thank
Mhm.
you. What's it called? A?
It's a maze. Let me make sure I'm saying it right. Now that I will actually refer to Amaze, and they have like Amaze Junior, so amaze.com, I believe is what it is.
I like that.
I know. I think it's just a good resource. And Darkness to Light's a good resource that actually teaches what to look for with child abuse. So like it's not this nebulous idea of like there's a man in the bushes constantly waiting for my child, but like actual concrete examples from parents who have gone through that really nightmarish experience and want to impart wisdom to other parents of what to look for. So I like both of those things.
Awesome. Thank you, Monet.
Thank you.
Bye.